Hey everyone, and welcome back, Today. Today we're diving deep into a topic that I think hits close to home for all of us. We're talking about gender disparities in health. We've got two really fascinating sources
Yeah.
to guide us. A global study from the super prestigious Lancet Public Health Journal. And then we also have an article from Murray PHN, which is an Australian primary health network. And that's going to be focusing on, the situation in Australia. So we're going way beyond just,
Yeah.
the usual assumptions about men's and women's health. And we're really trying to dig into the data to understand those very distinct challenges
Yeah.
that each gender faces.
I think what's interesting about this is that it's not just about who lives longer,
Right.
but also who lives healthier. And what really struck me was how much we often overlook
Yeah.
the burden of illness,
Oh, I-
especially when it comes to women.
Right. And that's a great point. And
Mm.
I think to kind of start us off, let's zoom out to that global perspective. With that Lancet study, they looked at the top 20 causes of disease burden
Mhm.
over the past 30 years. And one of the things that just really jumped out at me was that the gap
Mm.
in health outcomes between men and women hasn't really budged.
Yeah.
In that time, it's kind of like we're stuck in this time warp.
Exactly. And I think one thing I thought was interesting was that the researchers use this measure called DALYs, which is disability adjusted life years. And it's basically a way to quantify the years lost, not just to premature death, but also to illness and disability.
Got it. So it's not just about how long you live,
Yeah.
but how well you live those years.
Precisely. It gives us a much more complete picture of a disease's impact on people's lives.
Right. And, it gets even crazier because the study found that while women generally live longer, they actually shoulder a greater burden of illness
Mhm.
throughout their lives,
Yeah.
which is really counterintuitive.
Absolutely. It really challenges that common misconception that women are just inherently healthier just because they tend to outlive men. And it makes it clear that there's a much more nuanced story here.
Right. And the study highlights a couple of really striking examples. For instance, back in 2021, COVID-19
Yeah.
was the leading cause of health loss globally. But men experience a significantly higher burden, a staggering 45% more than women.
And what's interesting is that that difference wasn't uniform across the globe. The gap was widest in regions like sub-Saharan Africa and Latin America and the Caribbean. So it kind of makes you wonder about the social and economic factors that might be driving some of these disparities.
It's like a complex puzzle with all these interlocking pieces.
Yeah.
It wasn't just COVID-19. Heart disease, specifically ischemic heart disease, also showed a massive difference, with men experiencing a 45% higher burden of health loss. And again, geography played a role, with the biggest gap being in Central Europe, Eastern Europe,
Mhm.
and Central Asia.
And
Yeah.
the Lancet study actually had this powerful quote that I think really resonated with me. They said, "Our findings shine a light on the significant and unique health challenges faced by males."
So even though men might face a higher overall disease burden, particularly from conditions that lead to earlier deaths, it sounds like, we haven't really been as quick to address their specific health needs.
Right. And this is where looking at specific conditions, I think, is really revealing. So think about road injuries, cancers like lung and prostate cancer, heart disease, chronic kidney disease. These all disproportionately affect.
I mean, age factor is also really crucial here, too, because those gender differences might be small when we're younger, but they tend to widen as we age, the exception, of course,
Yeah.
is road injuries, which sadly impact young men heavily across all regions.
And this brings up a really crucial point for you, the listener. Early intervention is key. If we can target those behavioral risks, like smoking and alcohol use, that often start in adolescence,
That's
we might be
the-
able to make a real difference in men's long-term health.
It's surprising to hear that only a handful of countries have national-level policies that specifically address men's health. It makes you wonder why there's this gap in focus.
Yeah, it definitely raises some important questions about how we prioritize health resources and now turning our attention to women's health. The Lancet study identified conditions like low back pain, depressive disorders, headaches, anxiety disorders, other musculoskeletal issues, Alzheimer's disease, and HIV/AIDS as being particularly burdensome for women.
The interesting takeaway here, I think, is that these conditions don't necessarily cause premature death, but contribute to illness and disability throughout life. So it's a different kind of health burden
Yeah.
than what men typically experience.
Exactly. For example, low back pain is actually the leading cause of health loss for women globally, and their daily rates are a third higher than men's.
Man.
Unsurprisingly, we see that regional variation again, with the biggest gap being in South Asia and once again Central Europe, Eastern Europe, and Central Asia.
Right. It's like this constant reminder that health isn't just about biology. It's about, the interplay of
Yeah.
biology, social factors,
Yeah.
and even geography.
Absolutely.
And then there's mental health. Study found that conditions like depression and anxiety disproportionately impact women across every region of the world. So it's truly a global phenomenon.
And even within that global trend, there's variation. So the difference in mental health burden between high-income countries and Latin America and the Caribbean is significant, which suggests that socioeconomic factors are playing a role.
Okay, so now let's shift our focus a little bit
Mhm.
and zoom in on Australia using insights from that article from Murray, PHN. And it's fascinating to see how these global trends kind of play out in a more local context.
In Australia, we see that men and women share some common concerns, so things like mental health issues, chronic conditions, and the risks associated with physical inactivity and obesity.
But here's the thing. Despite having generally good access to healthcare in Australia, women still face unique challenges and often experience poorer health outcomes overall.
That's right. They're more likely to take on caregiving roles, face gender bias in the healthcare system, and of course have specific sexual and reproductive health needs.
And speaking of specifics, the article lists some of the most common conditions affecting Australian women: cancer, particularly breast, bowel, skin, and lung cancer, mental health and substance abuse disorders, cardiovascular disease, arthritis, and dementia. It's also a stark reality that women experience higher rates
Of domestic.
and family violence.
Let's not forget about endometriosis, which is a condition that often takes years to diagnose. The article mentions an average wait time of 7 years, which is just unacceptable. And organizations like Murray PHN are stepping up to address this by funding specialized clinics,
Yeah.
like the one in Bendigo.
That's great to hear. Now, shifting to men's health in Australia, the article highlights this stark reality that men have a shorter life expectancy than women
Yeah.
and are more likely to die from preventable causes.
And this echoes what we saw in the Lancet study. On a global level, it seems a key factor here is that men tend to delay seeking medical help, which often leads to later diagnoses and fewer treatment options.
It's like this worrying cycle. The article mentions some common health issues for Australian men, like mental and sexual health problems, cancers, cardiovascular disease, diabetes, injuries,
Yeah.
and back pain, which seems to align pretty closely with those global trends we were discussing earlier.
Yes, there are definitely parallels there. But what's particularly insightful is how the Australian context helps us understand those social and cultural factors that might be driving these trends in men's health.
Okay, so we've covered a lot of ground already. We've seen those global patterns. We've zoomed in on that Australian context, and we've explored those unique challenges faced by both men and women. So what stands out to you as the most significant takeaway so far?
I think for me, the most compelling insight is just the sheer complexity of this issue. It's not just about biological differences between men and women. It's about how those biological differences interact with this whole web of social, cultural, and economic factors.
It's like trying to understand a tapestry by just looking at a single thread. We need to see the whole picture.
Exactly. So let's try to unravel some of those threads. On the biological side,
Yeah.
we have those obvious differences in anatomy and hormones, which can absolutely influence susceptibility to certain diseases. We know, for example, that women are more prone to autoimmune disorders.
And it's not just about those predispositions either. It's also about the fact that women experience these hormonal fluctuations throughout their lives, like during pregnancy and menopause, which can have a significant impact on their health overall.
Absolutely. And then we layer on the social and cultural factors, gender norms, expectations about behavior, and even access to healthcare. It's fascinating how society's views and treatment of men and women can actually affect their health outcomes.
Right. It's almost like these invisible forces that are shaping our health destinies. For instance, men are often encouraged to be stoic and tough, which can make them really hesitant to seek medical help.
Precisely. And as we discussed earlier, that delay in seeking help can lead to later diagnoses and fewer treatment options.
It's a vicious cycle. On the other hand, women might face bias in the healthcare system, where their symptoms are dismissed, or they don't receive the same level of care as men.
It's a sobering thought. That highlights the urgent need for a healthcare system that is truly equitable and responsive to the needs of both men and women.
Okay, so we're starting to see how these social and cultural threads kind of weave into that fabric of these health disparities. What are some specific examples, then, of how these factors actually play out in real life?
Let's take cardiovascular disease, for example, which is a leading cause of death worldwide. Studies have shown that women often experience different symptoms than men, which can lead to delays in diagnosis and treatment.
So those classic heart attack symptoms we often hear about, like chest pain radiating down the arm,
Yeah.
might not always present the same way in women.
Exactly. Women might have more subtle symptoms like nausea, shortness of breath, or even back pain, which can easily be mistaken for something else. And this can have life-threatening consequences.
So it's really crucial then for both healthcare providers
Yeah.
to be aware of these differences and for women to really advocate for themselves and seek medical attention if they experience any unusual symptoms.
Absolutely. Now, let's shift gears a little bit and consider the impact of socioeconomic factors, which can significantly influence a person's health, regardless of gender. So things like poverty, lack of education, and limited access to resources all play a role.
But these factors can also intersect with gender in really complex ways.
Exactly. Women are disproportionately affected by poverty globally, which puts them at a disadvantage when it comes to healthcare access, nutritious food, and even safe living conditions.
And we know that poverty often leads to chronic stress,
Mhm.
which can have, negative impacts on both physical and mental health. So it's a heartbreaking cycle.
It is. And then there's the issue of education. Girls and women in many parts of the world still face significant barriers to education, which limits their opportunities for employment and economic empowerment, which further perpetuates that cycle of poverty and poor health.
So it's not just about providing healthcare services. It's about addressing these broader social determinants of health and creating a more level playing field.
You've hit the nail on the head. We need a holistic approach that tackles these interconnected issues if we're going to make real progress.
Okay, so we've talked about the biological and the social aspects,
Yeah.
as well as those economic factors that contribute to these gender health disparities. Is there anything else we need to consider?
Yes. There's one more crucial piece of this puzzle, and that's behavioral factors. So things like smoking, alcohol consumption, diet, and exercise. These lifestyle choices can have a profound impact on our health. And we see some interesting gender differences in these areas.
For example, men are statistically more likely to smoke and drink heavily, which we know increases their risk of heart disease, cancer, and a host of other chronic conditions.
That's right. And while women are catching up in some countries, men still tend to engage in more risky behaviors overall.
What about diet and exercise? Do we see gender differences there as well?
Absolutely. Women are generally more likely to eat fruits and vegetables and engage in regular physical activity.
But they're also more likely to experience body image issues and eating disorders, which is another side of this complex coin.
That's a critical point. Societal pressures and unrealistic beauty standards can significantly impact women's mental and physical well-being.
So once again, we see how those social and cultural influences, those invisible threads, can affect behavior and ultimately those health outcomes.
It's all interconnected. We can't just focus on the biological factors. We have to consider the powerful influence of these external forces on individual choices and behaviors.
Yes, okay. We've covered a lot of ground here. We've explored, the biological, the social, the economic, and the behavioral factors that all contribute to these gender disparities in health. It's a complex web, like you said earlier.
It is indeed. But understanding these complexities is crucial if we're going to develop effective solutions.
So where do we go from here? What can we do to address these disparities and create a more equitable health landscape?
That is the million-dollar question. And the answer, I believe, lies in a multifaceted approach. We need to tackle these issues from multiple angles.
Okay, let's break that down. What are some key strategies then that we could implement?
Well, first and foremost, we need to raise awareness about these gender disparities. We need to make sure people understand that men and women experience health differently and that these differences have real-world consequences.
Yeah. It's like that saying, you can't solve a problem you don't acknowledge.
Exactly. And once we have that awareness, we can start advocating for change.
Change in terms of policies, research funding, healthcare practices. What else?
All of the above. We need policies that promote gender equality and address those social determinants of health that we discussed earlier. We need more research funding to better understand the unique needs of both men and women. And we need healthcare providers who are sensitive to these differences and provide equitable care to all their patients.
That sounds like a massive undertaking, but clearly essential. So where do we even begin?
Well, it has to start somewhere. Every journey begins with a single step.
Okay. I'm ready to roll up my sleeves and get involved. What are some concrete actions then that we as individuals and as a society can take to make a positive impact.
That's the spirit. We all have a role to play in closing this gender health gap.
For example, we can support organizations that are actively working to improve the health of both men and women.
That's a fantastic start. We can also educate ourselves about these issues and have open conversations with our friends and family, spread the word, and get people thinking about these disparities.
Engage in those crucial kitchen table conversations.
All right.
But we can also advocate for change in our communities.
All right.
Contact our elected officials, demand better policies, push for increased research funding, and support healthcare providers who are genuinely committed to providing that equitable care.
Exactly. We have more power than we realize. Our voices matter. Now, before we get too carried away, it's important to acknowledge that there are some limitations to our discussion today.
Right. Good point. It's important to be mindful of those nuances.
For instance, we've primarily focused on the binary genders of male and female, but we know that gender is a spectrum, and there's a growing body of research exploring the unique health needs of transgender and non-binary individuals.
It's a crucial reminder, then, that the conversation around gender and health is constantly evolving.
And we also need to recognize that the experiences of men and women can vary significantly, depending on factors like race, ethnicity, socioeconomic status, and sexual orientation.
Right. We've been talking in broad strokes, but it's crucial to remember that everyone's health journey is unique, and it's influenced by a really complex interplay of factors.
Precisely. There's no one-size-fits-all solution.
Okay, so with that in mind then, let's move on to some specific recommendations, some actionable steps that we can take to create meaningful change. What comes to mind?
Well, I think one of the most critical areas that we need to address is data collection and reporting.
Right. The lack of sex disaggregated data. It feels like we're trying to navigate a maze in the dark.
Yeah.
Without a proper map.
Exactly. It's a major obstacle to understanding and addressing these health disparities effectively. We need to push for better data collection practices at all levels of the healthcare system.
From individual doctors' offices to national health surveys, we need to ensure that data is collected and analyzed in a way that allows us to see the full picture.
And of course, we need to make sure that this data is actually used to inform policy decisions. Data without action is meaningless.
Right. Okay, so better data is a crucial starting point. What else do we need to tackle?
We have to address those social determinants of health: poverty, education, gender equality. These are all interconnected factors that shape health outcomes.
So we're talking about advocating for policies
Yeah.
that promote social justice.
Right.
And create more equitable opportunities
Yep.
for everyone.
Exactly. Think about things like affordable housing, quality education for all children, regardless of gender, and paid family leave. These are all policies that can make a huge difference in people's lives and health.
It's about creating a society that supports well-being from the ground up. What else can we do?
We need to challenge. There's deeply ingrained gender stereotypes and promote a more positive vision of masculinity.
So breaking down those harmful norms, that can lead men to engage in risky behaviors and delay seeking medical help.
Precisely. We need to create a culture where men feel comfortable expressing their emotions, being vulnerable, and prioritizing their health without shame or stigma.
And this goes hand in hand with empowering women and girls to advocate for their own health and well-being.
Absolutely. We need to ensure that women have equal opportunities in all aspects of life, from education and employment to leadership roles.
And of course, we can't ignore the issue of gender-based violence, which has a devastating impact on women's physical and mental health.
We need to create a world where women feel safe, respected, and empowered.
These are some pretty profound societal issues we're talking about here.
We are, but they're all essential pieces of the puzzle. If we truly want to achieve gender equality in health, we have to address these broader societal issues.
Okay, I'm completely on board. What else can we do to move the needle?
We need to promote health education and prevention programs that are tailored to the specific needs of men and women.
So for men, that might involve educating them about the importance of regular checkups and screenings.
And for women, it's about empowering them to be active participants in their health care, to ask questions, and to advocate for themselves.
And let's not forget about the healthcare providers themselves. They play a crucial role in delivering that equitable care.
Absolutely. We need to encourage training programs that emphasize gender sensitivity and cultural competency,
so that healthcare providers are equipped to understand and address the unique needs of both men and women and deliver care that's respectful and responsive.
That's exactly right.
Okay. I think we've covered a lot of ground here. We've talked about the need for better data, addressing those social determinants of health, challenging those limiting gender stereotypes,
Yeah.
empowering women and girls, promoting health education,
Mm.
and improving the training of healthcare providers. It's a pretty comprehensive list,
It is, but it's not exhaustive. There's always more that can be done.
but I think it gives us
Yeah.
a solid starting point, a roadmap for action. So what's the next step then on this journey?
For me, it's about turning this knowledge into action. We can't just talk about these issues. We have to go out and make a difference.
I'm right there with you. It's time to move beyond the conversation and into action.
Absolutely. We have the power to create a world where everyone has the opportunity to live a long and healthy life, regardless of their gender. That's the ultimate goal.
All right, I'm feeling really inspired. What about you?
Definitely. It's time to get to work.
Okay, so we've delved into that intricate web of biological, social, economic, and behavioral factors that contribute to gender disparities in health. We've shown a light on those unique challenges
Yeah.
faced by both men and women, and we've explored some tangible steps that we can take to address these disparities and move toward a more equitable future.
It's been a fascinating and incredibly thought-provoking conversation.
I hope our listeners are feeling as fired up as I am
Yeah.
to make a difference.
But before we wrap things up, for this part of the deep dive, I want to acknowledge that we've only just scratched the surface.
There's so much more to learn about this complex and evolving topic.
Mm.
We encourage you to keep exploring, read books, listen to podcasts, engage in conversations, stay curious, and stay engaged.
And most importantly, don't be afraid to speak up and advocate for change. We all have a role to play in creating a more just and equitable world, a world where everyone has the opportunity to thrive.
We'll be back in just a moment for the final part of our deep dive, where we'll explore some real-world examples of programs and initiatives that are already making a difference. Stay tuned. And we're back for the final part of our deep dive into gender disparities in health. We've explored the challenges, the root causes, and some potential solutions. Now it's time to get inspired by real-world examples of individuals and organizations that are making a difference, proving that positive change is possible.
And what's really exciting is that we're seeing innovation and action at all levels, from grassroots community initiatives to global health organizations. So it's a collective effort.
So let's start local. That article from Murray PHN highlighted a fantastic example right here in Australia, the Endometriosis and Pelvic Pain Clinic in Bendigo.
This clinic is funded by Murray PHN, and it's providing much-needed specialized care for women suffering from endometriosis, a condition that, as we discussed, is often misdiagnosed and undertreated, leading to years of unnecessary suffering.
It's a perfect example of how targeted interventions can address specific health needs and empower women to take control of their health.
And it's not just about treatment. The clinic also focuses on education and support, helping women understand their condition and navigate the often complex healthcare system.
That's so important. Knowledge is power, and empowering women with knowledge is key to improving those health outcomes. Now let's zoom out to the global level. The World Health Organization, the WHO, has a dedicated program on gender and health. Can you tell us a little bit more about their approach?
The WHO recognizes that gender is a fundamental determinant of health, and they're working to promote gender equality and women's empowerment across all their health programs.
This is not just about creating separate women's health initiatives. It's about integrating a gender perspective into everything they do.
Precisely. They're tackling issues like maternal and child health, HIV/AIDS, and non-communicable diseases, all through a gender lens. Recognizing those different ways, these conditions affect men and women.
That's incredible. Are there other global organizations doing this kind of work?
Absolutely, there are many. One notable example is the United Nations Population Fund, UNFPA.
What's their primary focus?
UNFPA is dedicated to improving sexual and reproductive health and rights for everyone. They advocate for access to quality healthcare, education, and contraception, ensuring that individuals have the information and resources they need to make informed choices about their bodies and their lives.
And they also work to address those incredibly complex and sensitive issues like gender-based violence and harmful practices, such as child marriage.
Exactly. They're tackling some of the most pressing and challenging issues facing women and girls around the world. It's truly inspiring work.
Okay, so we have those global organizations and those local initiatives. What about something in between? Are there any national level programs that stand out as examples of best practices?
Yes, there are several countries that are leading the way in gender-responsive healthcare. One example that comes to mind is Canada,
What are they doing differently?
Canada has implemented a national women's health strategy that aims to improve the health and well-being of women and girls across the country. It's a comprehensive and ambitious approach.
So they're not just focusing on one specific issue. They're taking a holistic approach to address a wide range of health concerns.
Right. They're focusing on mental health, chronic diseases, sexual and reproductive health, and gender-based violence. They're looking at the whole picture.
That's fantastic. That's a fantastic model for other countries to emulate. And it's not just about government programs. There are also many nonprofit organizations doing incredible work in this field.
Absolutely. Organizations like the Global Fund for Women, which supports grassroots women's organizations around the world, are making a tangible difference at the community level.
And there's Women Deliver, an organization dedicated to advocating for the health and rights of girls and women, pushing for policy changes, and raising global awareness.
These organizations and countless others like them are making a real difference in the lives of women and girls, and they're inspiring others to take action.
It's a growing movement, gaining momentum every day. It's really heartening to see so much progress being made, but let's be realistic. There's still a long way to go.
That's true. But I'm optimistic. I believe we are moving in the right direction, and we have to hold on to that hope.
Me too. We have to believe that change is possible.
Absolutely. And we have to keep pushing for that change. Complacency is not an option.
Okay, so as we wrap up this deep dive into gender disparities in health, what are some key takeaways you want our listeners to remember?
Well, first and foremost, we need to remember that gender disparities in health are real and have far-reaching consequences. We can't just sweep these disparities under the rug. We have to confront them head-on.
We can't afford to be silent or indifferent.
Exactly. Second, we need to understand that complex interplay of factors that are contributing to these disparities. It's not just about biology. It's about those social norms, cultural beliefs, economic realities, and access to healthcare.
It's about recognizing that gender is a social construct that has a profound impact on our health.
Precisely. And third, we need to celebrate and support the incredible work being done by those countless organizations and individuals around the world who are dedicated to closing this gender health gap.
They are the true heroes of this story.
They are indeed, and we can all play a role in supporting their efforts, whether it's by donating to an organization, volunteering our time, or simply raising awareness among our friends and family. Every action, no matter how small, can make a difference.
It's about collective action, a ripple effect of positive change.
And finally, and perhaps most importantly, we need to remember that change is possible. It might not happen overnight, but if we remain persistent, if we keep pushing for a more equitable and just world, we can create a future where everyone has the opportunity to live a long, healthy, and fulfilling life, regardless of their gender.
That's a vision worth striving for.
Absolutely.
Well, that brings us to the end of our deep dive into gender disparities in health. It's been a long and enlightening journey.
I agree. I've learned so much, and I hope our listeners have too.
Thank you for joining us on this exploration. And I encourage you to continue learning about and engaging with this critical topic. The conversation doesn't end here.
Silence is not an option. We have to keep talking, keep learning, and keep pushing for change.
Together, we can make a difference. Thank you for listening,